Really, the purpose of these videos is to explain to current or future clientele about the different products and procedures that we have here at Skin and whether or not they are a good candidate for it. A lot of times, once people find out what you do, Dr. Colvin, or that we own a medical spa, they automatically ask all sorts of questions that they're curious about. And I figured a really good way to answer those questions is to just sit down with you and go through each procedure and talk about them a little bit more, because no one's more of an expert than you are. So the first one I wanted to start with is Botox. Obviously, Skin is known for being one of the premier places to get Botox in the city. So can you explain to me a little bit how Botox works to prevent and smooth out wrinkles?
Well, when Botox is injected, the muscle or the nerve cell actually will uptake that the Botox, and it doesn't allow the muscle to contract. When the muscle doesn't contract, it doesn't form those wrinkles. So when you get a result like that, it tends to almost stretch the skin a little bit, and it smooths and softens those lines.
Got it. So I can think of wrinkles almost as muscles that are getting stronger and stronger the more I use them.
Exactly.
And Botox prevents me from kind of using those muscles and making those wrinkles deeper?
So patients are concerned with the wrinkles, and that's kind of the end or final result. That's not my concern, if you can believe it. My concern is the amount of muscle contraction you get after Botox. So if you were to come back and you were to say, you know, I still have this line, but you couldn't move the muscle, I'd say that's the best result that you can get. So we have the same goal, but we get to that same goal kind of in a different way.
From different angles. So my perspective is I just want to get rid of the wrinkles, and you're looking more about the anatomy and the muscles, the strength. Got it. So one question that people always ask is, when should I start getting Botox? Do you have a recommendation?
It's a personal preference. I find our average age of Botox clients probably in their 30s.
Okay.
Botox is a want, it's not a need. So if you start to see lines, for some, there's no emergency Botox. If you start to see lines forming, I guess that would be a time that you could come in and we both assess it, see if that was really what you wanted or what you needed.
Okay. Talk to me a little bit about, I've heard people say, I get Botox, preventative Botox. What do they mean by that?
Well, preventative Botox, it does act that way, but you have to be consistent with it.
Okay.
So Botox does relax the muscle. It doesn't allow the skin to crease or wrinkle, and that, in effect, is preventing future lines. However, if you try it once and you never do it again, is that really going to have much of a prevention? It's not. If you're consistent with it and you do it for multiple years, that's when you will have the prevention aspect.
And the results you want. It's just like working out. You got to be consistent with it.
You go to the gym a couple times, you'll see the effect immediately, but it's not going to really last longer than when you go to the gym for that day.
Yeah, maybe you feel the effect, but you know, you're not going to see the long-term results that you'd expect.
Right.
Okay. And so what, you know, who wouldn't be a candidate for Botox?
Some people that have underlying medical issues, those that are allergic to it, albeit that's very, very rare. And some people, and we'll assess some at the time of the visit, some people just may not get a good result. So that all would depend on the appointment.
And how quickly after getting Botox do you see results?
You know, I've heard some patients will see it within hours. That is extremely rare. It usually takes at least 3 days to start to see a little bit of an effect, and it's a little more typical around the 5 to 7 day range. Okay,
so I get the injection. I am not going to look in the mirror and automatically see the wrinkle go away.
Right.
I need to wait 3, 5, probably a full 7 to 10 days before I see. Okay, got it. And you know, I think there's some myths out there about the downtime. So after I get Botox, can I return right away to work?
It is really a lunchtime procedure. You'll have what looks like a couple mosquito bites that last just a couple minutes. Some people's skin is a little bit more sensitive, maybe it lasts 15 minutes. So you can go immediately back to work. One of the risks always of Botox or fillers is bruising. It doesn't happen frequently, but that's really going to be the downtime associated with Botox. And the bruises will last, a typical bruise, it'll be, 5 to 7 to 10 days.
Is there anything you recommend that we don't do before getting Botox, like taking certain medications so that we prevent bruising?
One of the, probably the biggest medicines that cause a thinning of the blood is aspirin, Advil, naproxen. Now, if you came in and you said, I took those last night, it still wouldn't stop me from doing it because most people don't bruise from Botox. But to limit, if you have a big event coming up and you need your Botox, I'd say, try and hold off on doing those medicines for 7-10 days.
Okay. Another myth that I feel people always talk about is you can't work out after you get Botox. Is that true?
I don't like to inject and then have people go to the gym immediately after. I usually like people to wait 24 to 48 hours so that, because it is a liquid and it does diffuse. So, not only that, gyms are dirty places, lots of bacteria on it. So we've just broken the skin with an injection, and so the less risky behavior, if you will, the better.
Okay. That's good to know. And then how long will the results last?
So the studies have always shown about 3 to 4 months. Some people are less, some people are more, but think of between 3 and 4 months is a good average.
Okay, so it's kind of like highlighting my hair. I just need to expect that.
I guess so.
Well, yes, that is like highlighting your hair. Every 3 to 4 months, you need to go back. You need to be consistent with it so you have a nice look and you have the results that you want. So that's what I can expect. Okay. Now, here's a question that's always on everyone's mind is how much will I need?
Well, it varies for individuals. Some people have very weak muscles. Some people have very strong muscles. It depends on how much you're using those muscles too. So the crow's feet or the wrinkles around the eyes usually doesn't last as long because you're using that muscle a lot. If you're a trainer, if you're kind of a gym rat, you'll burn through that Botox sooner rather than later too. But it's going to vary for everyone, and it depends on the individual in the individual area.
Yeah. Also. Okay. Yeah, I know that for me, right between the eyes. I haven't done Botox in quite a while because I've been nursing, but right between the eyes, I take a ton of units, 50 units, whereas some of my friends only take 3 or 4. So it's really individual, right?
It is, but you're a very rare case.
I guess I just scowl too much. So is there anything else that we should let everyone know about Botox? I feel like we covered it.
No, you made a good point though. You don't want to be breastfeeding. You don't want to be pregnant at the time of Botox or fillers. If you're not pregnant the day of, it's fine to do Botox.
Okay, but if you're pregnant, trying to get pregnant, breastfeeding, probably not a good candidate.
Correct.
And then we talked about some people who are rarely allergic. But other than that, it sounds like a pretty simple, easy procedure.
Everyone loves it.
Yeah, it doesn't hurt. Just a little pinprick. I actually think it hurts worse to get your eyebrows waxed, but. Yeah, well, thank you so much. If that's all, then that was a really great overview of Botox.
Thank you.